Hello, I'm Bob Schrupp, physical therapist, and today we're going to talk about plantar fasciitis. I've treated many people with plantar fasciitis. It is a real bear to treat. I have found that I would say 50% of the patients that I treat get better fairly quickly, and the other 50% it takes a while. So what we're going to start off with today, I want to go a little bit into the anatomy and just enough so that you understand what's going on, and then we'll provide you some tips on what you can do on your own to try to treat this thing. Okay, first let's talk about what is plantar fasciitis. Plantar refers to the bottom of the foot. Fascia is a tough fibrous material that runs along the bottom of your foot. And when you call it fasciitis, that means it's flared up. So the fascia, the tough band, is flared up. So, just to give you kind of a demonstration, people are going to have to bear with the bottom of my foot, but here's the bottom of the foot, obviously. Brad, can you zoom in on that? You got her?
Got it.
Alright, the fascia generally runs from, or it does run, from the heel to the ball of the foot. And I've got just this blue material here to try to represent that. Can you see that, Brad?
Mm-hmm.
Alright, so it runs from there to there, and it obviously acts, I think, a little bit as a shock absorber. And what happens is somehow it gets flared up, it gets inflamed. There might be small tears in it. Some literature said, even if there's an arthritic process going on somewhere, it might cause some inflammation in the band. But either way, this is what we're trying to treat, is this band right here. And one way, let's jump right into the first tip that we might do. One, you may try to actually do some massage to that band. Especially if there's small tears in it, it helps get more blood flow into the area, and if there's some scar tissue there, you might break that scar tissue up and help it heal better. One way to do that is to do what we call a spleen massage, and I think, Brad, you're going to have to come in to help try to do this here. Another one is a cross fiber massage. This is Brad Heineck, physical therapist.
Hi. Okay, let's get over on this side. Alright, so Bob talked about the band going from, just think about the ball of the foot to the heel, and it's, well, you doing okay?
Yeah.
Yeah. Be careful if they're ticklish. And what we want to do is work that, and what I like to do is what Bob mentioned, spleen massage. You can have someone, both thumbs together, and then you go out like that, as if you want to get the skin to stretch. Okay?
That's good.
Yeah, it typically feels good. If it's painful, you're either doing it too hard or it's too flared up or too inflamed to do it at that time. At that point, you should probably use a cold pack on it or something of that nature to get it to settle down, maybe some ibuprofen. Okay. The other thing that I have my patients do, it's hard to do this one to yourself, but you can do some cross friction massage. The fibers of this run from in this direction. Okay, and we're going to go across the grain of the fiber, and you can do this with one thumb, and I like to start here at the metatarsal base and work this direction, and you get in deep. It's not just across the surface of the skin, but you want to push down and get into the tissue, not so it's real painful, but so you can feel it. We're trying to get some circulation increase in there so that the healing process is increased. Okay, and we'll go all the way down to the heel, and oftentimes with plantar fasciitis, you're going to feel a tender spot right in here. A lot of my patients, I'll find it right about in here, and that'll kind of make them jump a little bit. I know to stay away from that area and kind of work around it so we don't flare it up anymore.
As an alternative to the massage, what you can try to do actually is if you just have a golf ball, and you take the golf ball, Joni, if you want to pan down, put the golf ball on the floor, got your bare foot, and all you're going to do is roll your foot over the golf ball. And this is just another form of massage, kind of a deep massage. And that works pretty well. You can do this for a couple minutes, and you can do this a couple times a day. Just another alternative to the massage.
Okay, now if you have plantar fasciitis to the point where it's tender to the foot, when you get up and you walk on it, it really hurts if you touch it in a number of areas. It's tender. A real good way to decrease that inflammation and tenderness is use a cold pack, or in this case, ice. And what works well with the foot is you take any type of bottle that has water, and you can use an old Pepsi or Coca-Cola bottle, 20 ounce, usually works best. Fill it up so it's not to the top, so you have an air gap up there. Put it in the freezer for a few hours, and there you have a nice cold pack for your foot. Okay, and what you do is you simply set on the ground. We'll get zoomed in down there. Works best if you take your shoe off. That's a joke. Okay, so you're going to take your shoe off. Do not take the sock off though. Okay, you're going to leave the sock on so you have a little insulation, and you simply just go over the bottle and you just roll back and forth. So you're actually getting two things here. You're getting some benefit of the cold pack, reducing the inflammation, and you have some massage, and it's a gentle massage because you got that round surface of the bottle, and you go back and forth, and you'll do this for 5 to 10 minutes. It should feel good. If it's uncomfortable or you don't tolerate it, some people do not tolerate cold. Most people do, however, and it works great just to get it at the end of the day when your feet are sore and tired. Get that cold bottle out and roll it on here for 5 to 10 minutes. Okay, another effective form of self-treatment for plantar fasciitis is the stretching aspect. Okay, remember that the plantar fascia is from the metatarsus or the ball of the foot to the heel. Okay, and also to the heel bone or the calcaneus bone here is connected to the Achilles tendon, which goes to this large muscle group here. Okay, we'll just call them your calf muscles. So we want to stretch this whole band from here all the way up to here. We're going to break it down into 2 stretches. First of all, to stretch the fascia, what I like to do is do this, and you can pull your toes up and you stretch back and bring your toes up towards your knee and just stretch like this. This is one way you're going to feel a stretch right through here. Okay, you need to get those toes up and hold it. You can hold it for 10 to 15 seconds. Okay, if it feels good, you can go for longer, up to 30 seconds, but 30 seconds on a stretch will seem quite a long time, as you'll find out. A good 10 to 15 is typically enough, and you do that at least 3 times. Let it relax. You can do your soft tissue massage again, and then do your stretch. Then we need to go up to the calf muscles, get this area here. What I like to do for this, very simple. I've got 2 wooden blocks here. They're simply 2 2x4s. You need about 2 to 3 inches of height. It doesn't have to be exactly this. I've had people use books at home. Okay, make sure they're their older books, they don't wreck the binding. You can go on a stairway and do it if you got a shorter step. But with your shoe on, you simply put your foot here, right on the ball of the foot. Bring your heel down, and you lean forward, and you're going to bend the knee. Now that's going to stretch the soleus muscle, which the fibers of the soleus are very involved with plantar fasciitis and want to stretch those. But to get a complete stretch, then you also straighten the knee and lean forward. Okay, this works better if you have something to hold on to. For videoing, we don't have it. It's working fine for me right now, but just so you have some a better idea of how you should feel this and feel more comfortable. Okay, and again, here you're going to stretch at 15 seconds. You can go up to 30 seconds and 3 repetitions. Okay, you can just give it a break, wiggle that foot around a little bit, and then stretch again. Okay, don't get real aggressive with your stretches. If it's tender and it's sore and you do that and it's starting to bite and hurt, it's too early for it. Don't stretch too hard. Very effective way. It only takes about 1 to 2 minutes and you're done.
Okay, one of the typical symptoms that you see with plantar fasciitis is, and nearly all patients will describe this, is that when they get up in the morning and they try to walk, they get a sharp pain. I mean, it's very difficult to walk in the morning. And that's because all night long there's been healing going on. So let's say there are some minor tears in the fascia, and when you get up in the morning and you step on that foot, that scar tissue, you're actually stretching it and actually maybe breaking it open again, so you're getting pain. So one of the treatments that they've come up with to help to combat that is they've come up with a brace to help put the foot on stretch all night long. And I have seen studies that have shown that this has been somewhat effective. So we have Joni here who doesn't want to be seen, but we do have a brace. She actually does have plantar fasciitis, and she says this brace has helped. And what you want to do is, if you want to pan down now, Brad, you can see this brace here. And this is a brace from Bird and Cronin. But if you look online for probably plantar fasciitis brace, I'm sure you'll come up with something like this. But the idea of the brace is that it is going to hold the foot up a little bit. All right, it's going to stop the foot from dropping down. And what I'd like to see is that you're at least at a right angle, that you put the foot at least at a right angle. Brad, the other physical therapist, had mentioned even that he has seen some doctors recommend that even just trying to wear high top tennis shoes at night will probably help hold your foot up somewhat and prevent it from dropping. Now this brace has adjustments to it, and you can actually adjust it so that it does go up higher. But again, you want it to be comfortable, and you got to be able to sleep with it. And again, I would probably start off with it in just what we call the neutral position or the right angle. Another point to be made about the morning and shoes, the piece of advice we give to all of our patients is that you should no longer be walking barefoot. When you're walking barefoot, you're putting stretch on the fascia, and shoes, with their natural arch, they give you some support and they can protect the foot from further damage. So before you even get out of bed in the morning, you should be putting your shoes on. You definitely don't want to walk on hardwood floors without your shoes, but basically I'm telling you to wear your shoes all the time. The other brace that Joni had mentioned and that she's been using is a brace by Aircast. And this is kind of a unique design. What it is this part right here, this lower part, actually fits down into the arch portion of your foot. And there's an air bladder in there. And as you push on it, the air actually comes out of there, and there must be a tube that goes up into this bladder, up in here. And anyway, the bladder below does provide some arch support for the foot, and it makes it more comfortable. And this provides some arch support, or provides some support for the Achilles tendon. So this just, you slide your foot into this, and you Velcro this around. So if you can imagine, the foot would be pointed that way. It fits in there, and it works quite well. A very nice brace that you might want to give a try, by Aircast.
Okay, with plantar fasciitis, we really should talk about footwear and what you're actually wearing to support the foot to help minimize the irritation on that plantar fasciitis so that it has a chance to heal and increase it so you're not limping around for the next 2 or 3 months. What you want to do is get yourself a decent pair of shoes. Now, you don't have to go and get a pair of running shoes, but get a decent pair of shoes that offer good supports. This happens to be a pair of running shoes, which could work. One thing you look for on the inside of the shoe here, okay, this is the outside, this is my foot. We call this the medial aspect of the shoe. You want to look for good support here along the arch, okay, and you'll see if it's a shoe that, a $20, $30 shoe, if you go like this, it'll be very easy to bend right in here. Okay, on a stronger shoe that has a good support for the arch in the bottom of the foot, they're more stiff. Okay, and you'll see on the bottom they have supports here. Different manufacturers, they all have their own claim to fame on support for the bottom of the foot, but when you see it, you'll just see more support here. The next thing is always wear lace-ups. Don't wear Velcro shoes. You want to lace up, and you want to lace up from the bottom, tighten the laces from the bottom all the way up to the top so you get even support over the crown of your foot. Okay, and that'll help support that plantar fascia area. And the inside of the foot, or the shoe I should say, you can put a insert, take the factory one out because typically they're not very padded and don't offer much support, and you can go buy an insert. They have these at all shoe stores. Pull out the factory one again and get one that looks good and not real hard. I don't like the ones that are very rigid. Okay, a semi-rigid or a soft insert that has a cushion on the heel, and it'll be padded all the way up. You'll take out the old one. Usually they're a different size. You can put the factory insert on top of the new insert, and you'll find out this one's usually a little big, and you just cut it with a pair of scissors so it's the same size as the factory insert, and you simply insert it into the shoe. Okay. And like this. Okay, if you've been wearing these shoes and you get a pair of inserts, make sure you wash your hands before you go eat. Okay, got to have some humor in here. Therapists are typically have humor, and it's usually a little sick. So, here we go. There you go. You got your shoe, you got your insert, you're going to lace it up. And again, no walking on hard floors, always wearing your shoes when you're up and about.